Assalamualaikum. My name is Siti SURAIYA ZAINAL. My other members are AMIRA FATINI, BINTI AHMAD FATHILLAH, NURUL JANNAH BINTI ABDULLAH, NISA FATINI BINTI BASRI, and Ardini BINTI AHMAD SHAHRUL Amin. We are from Group 12, presenting our case study about menstrual pain.
Introduction. What is menstrual cycle? The menstrual cycle is a cycle of changes that occur on a monthly basis in a woman's body as she gets ready for potential pregnancy. The process occurs during the changes is ovulation, that is the release of an egg from one of the ovaries once every month. So there are two hormones that release during menstruation, that is estrogen and progesterone. The lining of the uterus will become thick and spongy due to these hormones to prepare for pregnancy. However, the uterine lining will shed through the vagina if ovulation occurs, but the egg is not fertilized with sperm. So this process happens in woman's body is known as menstrual cycle. Girls generally begin having periods around the age of 12, but they can begin as early as 8 and as late as 18. Each woman has a different menstrual cycle, which is measured from the first day of the period to the first day of the next month. Menstrual flow occurs every 21 to 35 days, lasting 2 to 7 days or more depending on the person.
What are the symptoms, causes, and treatments for a female having menstrual pain? First, to recognize the symptoms of menstrual pain. Second, to understand the causes of menstrual pain. Third, to identify the treatment for menstrual pain.
Methodology. Our group has done a survey by using Google Form with questionnaires related to menstrual pain. We use Google Form to distribute the questionnaire as it is more efficient and less time consuming. Our survey achieved 50 respondents in only one day, so after receiving the responses, the data was observed and recorded. The questionnaire prepared is divided into 4 categories, that is introduction, symptoms, causes, and treatment. The question asked is shown in the slide. This is the private conversation of each member with the respondent from the Google Form survey.
Results. Our respondents are mostly from the age of 17 to 20 years old, followed by 25 years old and above, then 21 to 24 years old, and lastly 13 to 16 years old. Next, out of all 50 respondents, 34% of them are found to start their menstrual at the age of 12 and 13 years old. For average menstrual cycle, 42% of the respondents have average menstrual cycle exceed 7 days, 32% have menstrual cycle exactly 7 days, and 26% of the respondents have less than 7 days average menstrual cycle. For the next question, 78% of our respondents was found to have been keeping track on their menstrual cycle. For the question, level of pain of menstrual, the highest vote on level of menstrual pain felt is level 3 and level 4, which both has a vote of 18 respondents. Next, here is result of days of menstrual pain. 14 respondents stated to experience menstrual pain at day 2. Here is the result of duration of menstrual cycle length, showing the different duration of menstrual cycle length of our respondent. And to the question, do you experience menstrual pain? 90% of our respondents answered yes to the question.
So, for symptom, during menstrual pain, 40 respondents vote for itching in lower abdomen, 28 respondents feeling pressure in belly, 29 said having pain in hips, lower back and inner thigh, 37 with mood swing, and 15 respondents felt sweating. From the data obtained, 22% 42% from the respondents still did not know that there are some causes that lead to menstrual pain. So 18 respondents said that drinking cold water is the causes, while 34 and 14 said drinking coffee, carbonated water, high in sugar content and dairy product, and also processed milk. 94% of the respondents know that there is a way to overcome the period pain but not immediately. 33 respondents said it can be overcome by having medication, 42 said hot pad, and 12 respondents with herbal such as turmeric, cinnamon, and ginger, while 12 respondents agree with yoga and exercises.
There are few symptoms of menstrual pain that most of the women experience. It include itching pain in the lower abdomen. According to the survey, 18% of respondents having an itching pain in their lower abdomen as a starter of menstrual pains. It is because during menstrual period, uterus contracts to help expel its lining. Hormone substances like prostaglandins involved in pain and inflammation trigger the uterine muscle contractions. The second one is feeling of pressure in the belly. According to the survey, 56% of respondents have a feeling of pressure in their belly before menstrual pain happen. It is because the fluctuations of hormones estrogen and progesterone can cause abdominal bloating and gas before and during their periods. Rising levels of estrogen in the days leading up to your period affect estrogen receptor in your stomach and small intestine. These higher estrogen levels can cause flatulence, constipations, build-up of air and gases in the intestinal tract. Next, pain in hips, lower backs, and inner thigh. According to the survey, 29% of respondents having a pain in their hips, lower backs, and inner thigh as a starter of menstrual pains. During menstrual period, prostaglandins that being released to your body help shade the lining in the uterus. Unfortunately, it not just affect the uterine muscles, but also can cause cramps in other muscles too. The fourth one is mood swing. According to the survey, 37% of respondents having a mood swing before menstrual pain happen. It is because fluctuations of serotonin, a brain chemical called a neurotransmitter that thought to play a crucial role in mood states, could trigger premenstrual syndrome symptoms. The last one is sweating. According to the survey, 30% of respondents said they are sweating a lot during premenstrual syndrome. It is because excessive sweating can happen before menstruation, especially at night. This is caused by fluctuation in hormone levels and a slight body temperature elevation in the luteal phase of the cycle. This condition is normal and doesn't require a treatment. Menstrual pain can be severe, and according to the survey, there are 62% of respondents having a upset stomach, 50% of respondents having a vomiting, 34% of respondents having a dizziness, 60% of respondents having a headache, 32% of respondents having a diarrhea or loose stools, and the last one is 40% of respondents having a fetum. And this is due to the high level of prostaglandins. If there is high level prostaglandins are associated, then more severe the menstrual cramps will happen.
Next, 68% of the respondents agree that coffee, carbonated and high sugar content water can cause menstrual pain. For coffee, it contains caffeine, which blocks hormone present in uterus, making it smaller, thus slowing blood flow, and this will result in inflammation and bloating. As for carbonated and high sugar content water, sugar worsens menstrual pain since it causes inflammation. The inflammation will be contracting all muscles and increase blood flow. This will result in heavy bleeding. Lastly, 28% of the respondents agree that dairy products, processed and red meat, and also cooking oils can cause menstrual pain. So here is the reason why. This type of food contain high prostaglandins and also arachidonic acid, which is the precursor in the production of prostaglandins. Prostaglandins can cause vasoconstriction, which trigger muscles in uterus to contract. This will lead to ischemia, where pain threshold is lowered and resulting in menstrual pain. From the data collected to the question of what do you think is the cause of menstrual pain, 36 of the respondents agree with cold water. So the question is, does drinking cold water really causes menstrual pain? The answer is no. Drinking cold water does not cause menstrual pain. The reason is, cold water has totally no impact on menstrual cycle since menstruation is linked to the reproductive system, while drinking and eating is linked to the digestive system. Those two systems are separated.
Based on the research that has been done, there are 6% of all the respondents that still do not know that the menstrual pain can be overcome. For the medications, such as painkiller can be get from pharmacy and also drugstore. Example of medication that can be used is Panadol menstrual pain and also ibuprofen. Next, hot pad also can use as method to overcome the menstrual pain, which will give us feel warm and relaxed. So, people will feel so much calmness. Example of hot pad that usually people use are reusable hot pad, electric hot pad, and also chemical hot pad. For herbal, such as turmeric, cinnamon, and ginger, are type of herbal that can be used as water because it warming properties, which are very effective to feel better when cramp happen. It also has soothing effect, which very useful when felt bloated and also nausea. Next, for yoga and exercises, according to a recent study, yoga can dramatically minimize the menstrual cycle's moderate to severe discomfort, abdominal swelling, and breast tenderness. According to a different study, women who added yoga to their regular routine twice a week for a period of 12 weeks had considerable improvements in their quality of life.
There are many symptoms of menstrual pain that was said earlier by JANNAH. 3 of them are headache, mood swings, and aching pain in lower abdomen. Along with that, many causes of menstrual pain that was said by NISA, which are drinking cold water, drinking coffee, carbonated water, or high sugar content water, cooking oils, processed and red meat. Thus, there are several treatments for menstrual pain that was said by Ardini and women can follow, such as medication, hot pad, herbal, and yoga or exercises. Therefore, menstrual pain like cramping, pain, or discomfort are common for women before or during period. According to Dr. Pratima Gupta in the year 2022, approximately 80% of women will at some point in their lives experience period discomfort. From the time you are in your early teens until the menopause, you can experience period pain. That's all from us. Thank you for your time listening